Three, two. I want to welcome you to Healthy Seminars. My name is Lauren Brown. I'm a doctor of traditional Chinese medicine, and I am your moderator. We are back with our series. This is the last one that we have scheduled with the group that Sharon Weizenbaum has organized. This formula is Ma Huang Lian Qiao Xiao Dou Tang. Hopefully, I said that correctly. And this is our series, Classical Chinese Herbal Principles in Action in Response to COVID-19. And our presenter, who kicked this all off, is Sharon Weizenbaum. So I'm very excited to have Sharon back. And as usual, I'm going to do our quick share here to remind you that on Healthy Seminars, you can go to the resources pages and find out the categories you want to look at. Click on them, and it'll take you down the page to find out what's happening. And we've created a nice calendar for you. So here we are, May 6th. I want to let you know that this is a great place to come to see free resources as well as CEU approved courses that are upcoming. On Friday, we have another free resource for you that's, I think, really timely. It's COVID-19 practice guidelines for acupuncture going back to work. So that's on Friday. You can sign up for that now. And then you can see we have a series of lectures coming up for the rest of May as well. I'm offering a 4-day workshop, 2 hours a day, so from Monday to Thursday for a total of 8 hours. And we have a talk next week on talking about sex drive and hormones. How do you make a baby when you're not in the mood, by Dr. Carrie Jones. That was originally scheduled for, or was a proposal for the Integrated Fertility Symposium that was canceled. So I'm very excited and grateful that we're going to have that happen anyhow. So just check out this page. And if you click the previous button, you can see what we've done previously. And if you missed some of the talks, some of those replays will be available still that you can check, and some of them may not be, but you can contact us, ask us about them. So just come back to the calendar of events. I want to let you know that Sharon offers a great graduate mentorship program. So you can check her website out, whitepinehealingarts.org. And also we have several courses by Sharon Weizenbaum and some of the teachers that she talks about, Dr. Feng Shuilun and Huang, and they're on Healthy Seminars, and they're all on sale for 25% month of May. And Sharon's diagnosis course, which is basically module 1 of her GMP that's available on Healthy Seminars. It's updated, newer version. The older version on Prody Legacy was 20 continuing education hours. This one is 54 continuing education hours, so much more comprehensive. And that on Healthy Seminars is on sale at 25% off for May. And during the month of May, if you had purchased the Prody Legacy version, that was 20 hours, we will refund you that full amount on the Healthy Seminars registration. So it's almost like a 75% saving. It's quite a good deal. A lot of you have taken advantage of that. So I want to make you aware of the coupon. It's Healthy25. Healthy25 will save you 25% off of all online courses. And our live webinars are already discounted. Our goal here is community, unity, immunity. So I'm glad to have you guys back with us and your cameras on. And at the end, we'll talk and send our love. Know that we open up the mics at the end. It has not happened yet where this has not happened. Every single time we open up the mics at the end, somebody is in a conversation with somebody else and not involved here, and we get to hear the conversation. It kind of takes it over. So be aware at the end, we are going to open your mics. And sometimes it's stuff that you don't want to hear. So be conscious of that. And if you stand up, make sure you're wearing pants or your clothes are up high too. We've had a couple of flashes as well during our webinars. So just wanted to put that out there, that be conscious, be present, be aware of your surroundings. Our disclaimer today, I just want to let you know that this is for educational purposes only. This is not medical advice. This should not be interpreted as medical advice because this is for educational purposes only. If you have a health condition, please seek out a healthcare provider. This, again, is for educational purposes only. All right, Sharon, you can bring up, and I'm just going to share that I'm grateful that Sharon continues to offer courses around the world and uses Healthy Seminars as her online platform. I've learned so much over the years. I cherish our friendship. I've said many times, and it's worth repeating, Sharon takes so much information and just distills it down and makes it accessible for the masses. And really, the analogy of rather than giving somebody a fish to eat for a day, she teaches you to fish to eat for a lifetime. just the knowledge that she is giving us is so valuable, and so I'm so grateful for that. She reads, she studies, she keeps learning. She's been in practice for over 30 years, and she studies like somebody that just came out of school, like her thirst for knowledge. And we get to benefit because she shows up quite regularly and teaches, and she has her graduate mentorship program to offer that interaction, which so many of us need as well. So Sharon, thank you for continuing to do this. It's such a pleasure to learn from you, and you have teachers teaching the way you teach, and so it's like a virus in a good way, a good virus if you could have. So it's spreading, and it's really wonderful. So thank you again for teaching. I'm looking forward to your talk today.
Okay, thank you, Lauren. Okay, so today I'm going to be teaching about a really cool formula. I hope that by the end of this, you feel like you have some access to this formula that's kind of a strange formula. It's one of those formulas you look at and just think, God, how would I ever use this? And so I hope by the end you see how it might be really useful in your practice in a regular way. Okay, let's see. I'm going to share my screen here. And there we go. So the formula is Ma Huang Lian Qiao Xiao Dou Tang. And we're looking at this in relation to what's going on with this virus. Ultimately, we'll get there. Okay, so here's the formula. We're going to go into it pretty intricately to understand the way it works in the space-time dynamics that I've been talking about. So first off, it's in the Yang chapter, and it's in the part of that's about transmuted patterns. And within the transmuted patterns in the Yang chapter, there's the yellowing patterns. So that's where you find this formula. And there's only one clause that talks about this formula, clause 262, and it says there's shanghan, there's like cold damage, congealed heat in the interior, the body will turn yellow. Ma Huang Lian Qiao Xiao Dou Tang is indicated. And I just have a note here that it says that the formula should be cooked in rainwater. Zhang Zhongjing was specific about this, that it should be cooked in rainwater. And in the commentary, it says that the rainwater is lighter than regular water, and therefore it won't tend to make the dampness worse. So I just thought that was a really interesting note. But I'm going to go into this clause in a little more depth, in part to talk about what this clause is referring to, but also to kind of introduce a way of reading the clauses. So here it starts with, there's been shanghan. And so often the clauses will start with something like, Shao Yin Bing or Shanghan or Taiyang Bing. And so when it says here that there's been shanghan, this is damage from cold, one thing we want to keep in mind is that there are broad meanings for shanghan and narrow meanings for shanghan. So broad meanings are just like something's happened that's pretty strong. There's been an influence in the body that's pretty strong. And so, and then it goes on to say, and now look at, this is what we're seeing. And so it doesn't necessarily mean that there's been like cold damage, like in a Ma Huangtang pattern. To me, it doesn't necessarily mean that because of these broad and narrow meanings. And so, one thing I do with my interpretation of the clauses is just to try something on, like, so if this is meaning it in the broad term, something happened that was pretty strong, and now there is, and then it follows, what do I notice if I look at it that way? If I look at it in the narrow sense, like there's a Ma Huangtong pattern, and now there's this. And so, we can't really say truly what did Zhang Zhongjing mean. We know the text is very cryptic, and we can't say for sure what he was actually talking about. So what we can do is try things on and see what shows up for me, what gets clear for me if I think about it in this way. So how I'm thinking about it here is something happened that was pretty strong, and now there's this congealed heat. And this character for congealed, yu, it means, it refers to blood stasis. You know, it's something that's something physical that's gotten really silted up. And it almost always refers to blood stasis. And there's a lot of commentary about this clause. And people generally agree that this is referring to blood stasis. And so it's congealed, and it's either, when it says congealed heat, it means it's either mixing with heat or it's congealed because of heat, you know, that the blood has gotten kind of cooked down and thick. So something happened, and now there's this congealed heat, this blood stasis with heat, and it's in the interior. So there's something going on the inside, and the body will turn yellow. And so, you know, one thing that we like to do in my program is to think about the Shanghanlun kind of being written in a code that's giving you a picture of a phenomenon, and not necessarily you have to see these symptoms. You know, and certainly this formula is a jaundice formula, no doubt about it. But there's also, you definitely do not have to see jaundice. And so what does it mean that the body turns yellow? And one way we can think about this is that there's this congealed stuff going on due to heat because something happened on the inside, and that this is now showing up on the outside. So we can summarize this clause as something happened, and now there's congealed blood heat inside the body, and it's showing up on the outside of the body. And so if we read the clause this way, I think that at the end of this presentation, when we get to the kinds of diseases that show up when you have this presentation, it will make sense. But this is also to kind of give people an idea of, you know, how we can think about the clauses in general. You know, there are some traditions that look at the clauses very literally, like you need to see this, this, and this symptom. And so I think that we get very limited in what we're able to treat with these formulas that have a really broad application. So if we only use this for jaundice and think, oh, it's a jaundice formula and I'm not going to think about it otherwise, we'll miss so many opportunities. So this is something we do in the GMP, is when we're learning the formulas, is really look at what's the clause trying to actually say. Okay, so now this transmuting yellowing diseases, so that's the clause about the formula. But before that, there was some discussion about what are these transmuted yellowing diseases. And transmuted means that, you know, you started off with one pattern, and then something happened that was not the right thing to happen. And so it then changed. And, you know, and sometimes it seems like there were all these people like mistreating, you know, and that they were purging all the time, like almost like colonics and purgatives were like the medicine du jour, or, you know, you either make someone sweat or make them poop, and people were giving mistaken treatments all the time, and that may be so. But another way to think about transmuted patterns, and I think I mentioned this in a previous lecture, is just you know, that instead of going down, something went up and out, you know, or instead of going up and out, something went down and in. And lots of things can come along that make the you know, make the wheel of the body go in directions that might not be best for that illness. You know, so let's say, for example, you have, you know, a Guizhi, or let's say a Ma Huang Tong pattern, where you need for yang to go up and out, and then you have like a milkshake, you know, that's going to be really cold. It's the wrong temperature, the wrong direction. for that to go, for that particular pattern. And so we can think of transmuted patterns as mistreatment, but also just things happening that are not exactly the right things to be happening. So here, there's Yang disease. There's an absence of sweating and abnormal urination. And here, this is often translated, this Buli is often translated as inhibited urination. And really, I think I mentioned it in a chat with the last lecture. This Buli just means abnormal urination, which can include inhibited urination. Then it says there's anguish in the heart that's hard to describe in words, and there will be generalized yellowing. And Liu Zhou has a commentary about this clause saying, at the beginning of the disorder, it's common for the patient to have a feeling of anguish in the heart, to dislike the smell of greasy food and seafood, to have a feverish body in the absence of sweating. At this time, one should request detailed information about urination, such as whether there's a concentrated or small amount of urine, as well as the observation of the yellow color of the sclera of the eyes. In a day or two, the yellow color will spread over the body. And so that yellowing of the sclera is something that it would come before the jaundice of the body. So careful looking at the color of people's sclera. And so, keeping in mind that we're talking about the virus, this is something that people feel. They feel, like anguish. They feel frightened. They feel uncomfortable in their spirit. Now, some commentary says that the heart here is actually talking about the tummy. And so even with that, people, they get some nausea. They have a really poor appetite with a feverish body. So we can see that this might apply. So Yang disease, this is also a clause. Yang disease, a fire method is used. Slight sweat issues from the forehead. There's abnormal urination. There will be jaundice. So then it goes on to say, if the pulses are floating and tight, there must be periodic tidal heat. On the other hand, if the pulses are just floating, there will be night sweats. So one thing I wanted to talk about based on this clause, a couple of things is, we'll look in a second about what goes on if there's a fire method used in this case. But with the pulses, it's saying if the pulses are floating and tight. And so floating, we think of meaning that it's still on the exterior, but floating also means that it can be in the upper body, failing to go down. That there's a blockage in the Taiyang that we've talked about a lot, and there's also a blockage in the Yang Ming. So everything is staying up above and not being able to go down. And in this case, the periodic tidal heat is due to the dampness and the heat that's here, the damp heat. And if, on the other hand, the pulses are just floating, and that means that they're not tight. So there is not a block on the outside of the body. Then there'll be these night sweats. The sweating will come out easily. We'll get to this idea of the fire method that was inappropriately applied, but other formulas that are in this, that are for this damp heat kind of yellowing, Yin Chen Hao Tang, Zhi Zi Bai Pi Tang, and then the Ma Huang Lian Qiao Xiao Dou Tang. These are the formulas mentioned in this sort of subcategory of Yang Ming diseases. So here we have this kind of wheel of life, right, that we've looked at quite a bit. And so we're thinking in this way of looking at the physiology, we're thinking of the Yang Ming as very important for bringing the life force down and in the body. It's not like it comes down through the digestion, but it depends on the digestion, that vertical axis of downward movement. It depends on that in order to come in. It also depends on the breathing of the lungs, the descending breathing of the lungs in order to be able to come into the body. And so that's on the right side of the circle that in this diagram is on the left of your screen. So we think of this as the yang is coming down and in. And so what's going on with pathology is that the yang ming is too slow. So let's look at the wheel going. Well, just another note. In general, a yang conformation that's going too slow is because of blockage. Something is blocked and therefore it's going too slow. So here the yang ming is going too slow. So the life is going at its normal speed, but look at over there, the yang ming isn't going down fast enough. So it's going too slow. And I'm going to go back and I'd like you to just imagine your breath and your digestion and imagine life is coming through you and just what it feels like if your digestion is too slow, it's blocked, or your breathing isn't being able to go down the way it should. And just look at that and just feel like what that feels like in your body. Like, ugh, that feels very claustrophobic and stuck. And so, that's something that we're actually looking at quite a bit with this illness. So what can happen especially in this formula pattern? First let's look at what should happen. What should Yang Ming be doing? They should be going around at the same speed. In other words, we should be aligned with nature, going at the same speed. And what happens instead is you get this pent up heat because the life force is warm. It's not able to come into the body. So it gets blocked and it builds up and gets hot. And also, if you think about your digestion, what are we doing? We're eating food and fluids. And if that gets blocked, fluids can get blocked very easily as well. And it can sort of turn into this damp heat. So let's just keep this image in mind about this formula, that this is primarily a Yang Ming not descending the way that it should, going too slow. And so there's heat developing and fluids are also developing. So this sort of relates to the idea that we talked about in the very first lecture that I talked about, where when we ask, like people will talk about, this virus as like a damp or a hot, damp virus. But here what we're seeing is that actually another way we can look at it is that the virus slows down the Yang Ming, and that the dampness and the heat that develops is our very own life force, along with all of our fluids getting blocked up. And so the damp and the heat don't come in from the outside. Certainly if we lived like in a really warm, damp environment, and we tend to suffer from damp heat anyway, our response is going to be worse from this virus. And so what happens is you get jaundice. Like now it makes sense. You would get some jaundice, this yellowing and abnormal urination because fluids are not able to clearly flow down. So we really want to have the picture of this in our minds. Now we add fire method. So when we look at this picture, we can see what happens if you add fire method to this. And we see, of course, that's going to make it so much worse. If the Yang Ming is already going a little too slow and then you add the fire method, it's really going to make it worse. Okay, so now what about this congealed blood? Because if we look at the ingredients of the formula, and we go back, sorry, I should have go back and we're like, what? Congealed blood? Where is the congealed blood here? So let's look at that. Sorry, go through all these slides. I have a quote here. Wang Qi and his colleagues have done thorough research for these herbs based on the Shenong Bansajing and the Jingui Aloe, as well as other books. They've proved that all three of these herbs are capable of promoting blood circulation for blood stasis. And I got that from Guo Huilio's discussion of cold damage. So we do have herbs that are actually working with blood stasis, and we'll look especially at the Lian Qiao and even more especially at the Xiao Dou to look at how they work with blood stasis. Okay, so this formula is Ma Huang Tong without guizhi, so the diaphoretic effect is weaker. It opens the exterior to open the lungs to allow damp heat to leave through the urination. This formula adds shengjiang and dazao to Ma Huang Tong to replenish fluids from the stomach. But we want to notice something. It's not exactly Ma Huang Tong without guizhi, because in Ma Huang Tong, which I have a picture, Ma Huang is more than 1/3 of the formula. And here it's less than 1/10 of the formula. So just think about the difference in the power for going up and out between Ma Huang Tong and Ma Huang Lian Qiao Xiao Dou Tang. Like, it's so much less in our current formula. So we don't want to really think of it as Ma Huang Tong without guizhi. You know, we want to really realize that the force to go up and out is very, very small. Whereas the force to go down and in is much stronger. In addition, Ma Huang Tong has guizhi, which very much potentiates the Ma Huang's up and out capacity. And even compared to something like Ma Xing Shiguan Tong, very, very different in terms of the proportion of up and out to down and in. So we always want to look at not just the dose, but also the proportion of herbs. It's very important to be able to understand what a formula does, because otherwise we might think, oh, well, this is, you know, really going to resolve the exterior very strongly. And, you know, does the exterior still need resolving? And how do I know? And in my opinion, you don't need to have at all the feeling of coming down with something for this formula, because the amount of up and out is so small. So, you know, this is another long-term lesson about how to look at formulas, you know, not to just look at the ingredients, not even just to look at the dosages, but look at the proportions. You know, so we have these proportions of Xiao Dou and Sheng Zi Bai Pi, which is most often we substitute Song Bai Pi, and that's been being done by many doctors over many years, that those dosages are very high relative to the other herbs. So, okay, so Ma Huang and Lian Qiao, they're both leading herbs, meaning the formula is named after them. And so they're quite important to the formula, but the dosages of both of them are very, very small. And so there's something we want to keep in mind. There's something really key about what these herbs are doing. And yet also keep in mind that the percentage is very low. So pungent Ma Huang, Lian Qiao, and Shengjiang are all less than 1/10 of the formula. So if we have these arrows indicating, you know, the strength of the formula over here, you know, going up and out, it's very slight. And that the function of the herbs to open up and out is really to open so that the damp heat can then move out through the Yangming, through the urination, to clear away the damp and clear away the heat. You know, so we're not looking at forcefully going up and out. We're just saying we want to make sure the surface is open so that everything can drain below. And just reminding you of the image of the straw, when we have our finger over the end of the straw, and it means that the fluids then can't go out from below, you know. So we don't just want to make the fluids go out from below. We want to make sure the finger is off the top of the straw so that they can go out below. So that's how it will work. Now so we look at a little at Ma Huang Lian Qiao. We'll look at Lian Qiao again in a little more detail, but let's just look at this combination of Shengzhang and Dazao, because it's obviously a really common combination. And I'll tell you how I think of it is that they harmonize. And so what exactly does that mean? So you've got a pungent, warm, and a sweet, greasy herb put together, and they're just often put together. And Shengzhang, we know it goes to the stomach and its action is very fast. So it sort of gets something going and then it kind of goes away. And so what, in this sense of harmonizing it means any yin yang pair that's separated from each other, we bring them back into right relationship. And so with this, what we have is the Wei and the Ying. And what Shengzhang, and here you see the Wei, has to be underneath and inside the Ying in order for them to be harmonized. The Wei is Yang. Anytime there's Yang combined with Yin, the physiological relationship of those is that one is inside and underneath the other. So the Yin goes down, Yang goes up. So in order for them to come in relationship with each other, the Yang has to be underneath and below. So harmonized Yin and Wei means getting that Wei inside the Yin. So Shengzhang comes in, and it is spicy hot ginger. So it's getting that Wei going from inside the stomach. And Dazao is sweet and moist. And when these two are mixed in the stomach, it starts this steaming, this moist steaming action. Now in this formula, it's for a couple of things. One is to get helping the Ma Huang and the Lian Qiao resolve the exterior. But the other is to make sure that we're replenishing physiological warmth and moisture as we're going through this process. So a lot of times when you see this in a formula, this pair, think about how it's there to offer replenishment of warmth and moisture from the middle of the body. So ginger and dates, when they are mixed together in a formula, they can create a sweat starting from the stomach, replenishing the physiological fluids, as well as replenishing nourishment. So let's look at Lian Qiao. And we want to notice that the Lian Qiao is like the outer husk of the forsythia seed that is there in the autumn. And we want to notice that anytime something is an outer crust, it's working more on the outside of the body, such as like dafu pi, a lot of peels work on the outside of the body. And so Lian Qiao is no exception to that. So the Shendong Bancao Jing says it's bitter and neutral. It governs cold and heat, mouse, fistula, lymphadenitis, which means, hot swellings that are in the neck or in the groin or the armpits, welling, abscess swelling, malign sores, goiters, tumors of the neck, bound heat, and goo toxins. And then Zhao Shuda and almost everybody else also adds that it's acrid and also says that it is cold. And so it's considered to clear heat and resolve toxin, for resolving toxic sores, expelling pus, swollen, welling, abscess, sore, swollen throat, and just in general, upper burner heat. We can see why Lian Qiao would be a very good herb for skin diseases because it's a husk, and also for hot skin diseases. And so we'll see that as a key thing for this formula. Also, it's a very good herb for what the Shenrong Bansao Jing says for these goiters and tumors of the neck. Um, and I learned from Dr. Huang, and I've used this so much in my practice. Like if someone has a sore throat and the glands are really swollen, just add Lian Qiao to the formula in a pretty high dose, like about 3 times of what the standard dose in the formula. So often if somebody say they have a Xiao Chai Hu Tong pattern with a sore throat, but their glands are also swollen, I'll often add a bunch of Lian Qiao, and it's really excellent for those kinds of swellings, but also for toxic heat, skin problems. Okay, then we'll look at Song Bai Pi and Xiao Dou, and these are in such a high dose in the formula. So first we'll look at Song Bai Pi, and it's a metal herb of the earth class in the Tang Ye Jing, and it brings cool moisture into the earth, kind of like bringing metal, like bringing autumn to the earth, and so like other peels, again, it's a peel. It goes to the skin and it treats skin water, like water swelling on the skin. Being cool, it's also going to treat skin diseases on the surface of the body. You think of, there's a formula that called Wu Pi Tong, the 5 peel decoction. And what's that for? It's for water swelling on the exterior of the body. So just this idea that these peels, Da Fu Pi, Shengjiang Pi, Chen Pi, Song Bai Pi, they go to the surface of the body. So the Shenrong Bansao Jing says it's sweet and cold and non-toxic. It governs damage to the center, the 5 taxations, and the 6 extremes, marked emaciation, flooding with expiring pulse. It supplements vacuity and boosts the qi. Zhao Shuda says it's also pungent, and it drains lung fire, downbears lung qi, and disinhibits urination. Drains Formulas and Strategy says it drains water qi in the midst of the lungs, or it can treat when the lungs have fire from excess. Facilitates the transformation of watery phlegm, and it's used when the wheezing and swelling are due to an excessive accumulation of water and phlegm. So we see that it's like opens up the lungs in a cool way and allows these fluids, whether they're in the surface of the body as some edema or a skin disease, and or it's fluid in the lungs, and it allows that to leave through the urination. Similar to and working with Xingren between the lung and urination, and also with the Xiao Dou. So we have Xingren in the formula as well. So we see that we're kind of opening up the lungs in order for there to be this downward cooling movement of fluids out of the lungs. Ye Tianshi says Song Bai Pi is cold and inherits the qi of water and enters the kidneys. The flavor is sweet, so it obtains the flavor of earth. It enters it enters the spleen. The center is the middle region, and the spleen is the source of the yin qi. When heat damages the center, sweet, cold, Song Bai Pi governs this. So you imagine the center being hot and it starting to damage the fluids. And the center, of course, is Tai Yin, so it also affects the lungs. So the fluids don't drain down, but they also start to get hot. And over time, that damage to the fluids is going to even cause emaciation. So this is Chen Shouyuan says, if the Zongfu are both vacuous, the flesh is reduced, and therefore there's emaciation. To govern this, use the sweet flavor of Songpi to secure the spleen qi and supplement the insufficiency. Use the cold of it to clear the internal heat and abate the fire evil. When the evil qi is abated, the spleen yin is then full, and the spleen will govern the flesh. So it's like there's this smoldering, thickening of all these fluids, and you add Song Bai Pi, it's going to cool that so those fluids can then be regenerated and then turn into the muscles and flesh of the earth element. Okay, so now we're going to move to Xiao Dou. And, you know, chalky herbs are one of my favorite subjects, and beans are considered chalky. So it's chalky, so that means it balances fluids, but it's also red. So it relates to the blood, it disperses congealed blood, but also the red says it enters the heart and the small intestine. So I want to talk about this chalky flavor and this character to seep or percolate. In the last webinar on Monday, there were some questions in the chat about what does it mean to percolate dampness or seep dampness. There's this character chen, and you know, what does that mean? And so here's a picture of two ways that we can have problems with water. One is if there's a desert, and this is a picture of an arroyo. You know, an arroyo is something that is like where when it rains, the water flows through here, but nothing gets absorbed because of the nature of the soil. And so the water just drains off too quickly. You know, so you can add water, but it drains off too quickly. And if our body is like this, we get something called dispersion thirst, meaning we're thirsty and we drink and drink and drink, but the water just goes out. You drink and then you pee. That's what Zhang Dongjing says about dispersion thirst. You drink and then you pee. For every ounce you drink, there's an ounce of pee. And so that can be a fluid metabolism problem when the earth is too dry, when our spleen is too dry. On the other hand, our spleen can be kind of muddy, and therefore when it rains, all the water just like sticks around and gets murky, and it also doesn't drain. And so when we buy a piece of land, and it has to pass a perk test in order for us to be able to build on it. And if it's all muddy like this and doesn't drain, then you can't put in a sewage system because that won't actually drain. It'll just kind of hang around. So you fail your perk test and you can't build there. So this kind of land doesn't percolate. It doesn't, like coffee going down, like it doesn't drain well. So both of these are problems with fluid metabolism. And so when we give herbs that seep dampness, they help percolate. They work for either kinds of soil, and some work better for one or for the other. But either way, what it's like when we add these chalky herbs is we can say we increase the absorptive capacity, which allows fluids to drain appropriately. You know, so in the desert, if you increase the absorptive capacity, then water, it will rain and it gets absorbed into the soil and it will drain, and it'll be more like a stream rather than a arroyo where it just washes away. In the muddy soil, if you add peat moss, you know, then water gets absorbed well and then can drain away. So when we give chalky herbs, you know, and there are all kinds of them, and they go to different places and they have different temperatures, but they all look kind of chalky. You know, so we have Fu Ling, we have Shan Yao, we have Tianhuafen, we have Gegan, we have Yiren, we also have Xiao Dou. So when we give chalky herbs in a general way, they turn it into this. You know, you're able to absorb the moisture so life can happen, things grow better, and water drains away. And so it's a little bit of a contradiction. Like you'd think, oh, if I'm draining dampness, that's the opposite of keeping it in my body, you know? But it's not. When we absorb it well, when we have a good absorptive capacity, we also drain well. So it's not that Fu Ling supplements the spleen on the one hand and drains damp on the other. those two things are very connected with each other. It supplements the absorptive capacity of the spleen so fluids can drain appropriately. And for me, this is an incredibly important concept, that really changes how you think about the herbs. Some of these herbs are just so not diuretic. Most of them are considered bland herbs, but they're not like bitter cold diuretics like bian shu or chu mai, which, drain through being bitter and cold. These drain through increasing in the absorptive capacity. So we want to, again, a little tangent to give a long-term lesson about physiology and the mechanisms of the herbs in general, so we can then bring that understanding to this formula. So this formula uses the chalky Xiao Dou. So it's considered sweet and a little bit sour and slightly cold, and it enters the heart and the small intestine. So it promotes urination in the way that we just talked about, and so it can reduce edema. It facilitates the resolution of dampness, and the cool quality helps it if there's dampness mixed with heat. So it's also used for mild cases of jaundice, but it's also red. And so it enters the blood, and by cooling and facilitating the absorption of fluids, like good fresh fluids, the fluids aren't dried up and congealed. So it helps to promote this kind of much more volatilized flowing blood, reduces swelling and reduces the fire toxicity. So the Neijing says all painful, itchy ulcers belong to the heart. And Xiao Dou enters the heart and small intestine channel, where it disinhibits and dispels dampness, harmonizes the blood, discharges pus, scatters swelling, and resolves toxin. The Ban Sao Gangmu says Xiao Dou treats all ulcerous sores and scabies as well as red swellings. So you can kind of see where we're going. All these go to the skin. So we're going to have like dampness on the exterior of the body, damp swelling, but also skin problems. So we'll see how that all sort of ties together with what we're seeing with this virus. Okay, the commentary on the classic of the Materia Medica: sores swollen with pus and blood are a disorder of the blood aspect. Edema is a disorder of the qi aspect. How can Xiao Dou treat both? The reason is that both the qi and the blood originate in the spleen, and because of this, we know that the blood and water, although different, flow from the same source. Dredge that source, and there will be no obstruction to the subsequent flow. Sores swollen with pus and blood indicate excessive fire. Edema indicates insufficient fire. So the fact that it can treat both shows that while it reduces overabundance, it also supplements insufficiency. So I hope that our discussion about seeping and chalky herbs gives you an idea of how it could treat both the blood and the fluids. So it clears heat, resolves toxins, scatters blood, disperses swelling, opens the breast, and promotes birth. So another way that it opens things through that are blocked. And that's also in the Yao Xinglun, where it opens through the qi. And then there's also this idea that one should use 1.5 to 2 kilograms of slightly fried Xiao Dou decocted in water. It can be taken as a tea as one likes to treat abdominal pain due to the failure of the lochia to come out. So sort of post-birth, drink this as a tea in order to help the last of the products of the birth come out. So here are all the ingredients now put together. So we have the Ma Huang and the Lian Qiao, and we can kind of put that together with Shengjiang Dazao, like we're going up and out just a little bit. And then we have all of these herbs that really go down and in. The Xingren, also the Lian Qiao is bitter. And remember, Ma Huang's also bitter, so it even has a down-bearing quality itself, helping the down-bearing. But then this large dose of Xiao Dou and Songbai Pi. So it's clear we're really helping the Yang Ming to open it through the urination with this formula in a cool way that's going to also treat the skin and, you know, clear the blockage and so the heat from the Yang Ming. So let's see what it does. This is our pathological situation, right? Yang Ming is going too slow. And so there's this development of heat, both up above, but also heat and kind of damp turbidity that is also affecting the skin. That's our situation. So we're going to slightly open the exterior in order to open below and replenish the physiological and harmonized yin and wei with the shengjiang and the dazao. And then we're going to open the yang ming downward through the urine. So the lung, sorry, I didn't edit that well. But anyway, we're gonna, the lung to water and heart, small intestine to water connection, you know, so we're opening that up to flow out below, but also taking our finger off the top of the straw up above. So here's some writings about the formula explanation. So when there's damp heat combined with yellowing, in addition to jaundice, there's heat effusion, aversion to cold, no sweat, and body itching. Damp heat is combined with an exterior pattern. Now remember that the exterior pattern is really minor, so you don't need to see aversion to cold, not at all. And there can also be, it's a damp heat situation, so there can be sort of moist skin, you know, but you're not looking for this majorly blocked exterior with absence of sweating. So we don't want, you know, like, wait, their body is kind of moist and they sweat in the afternoon. It would not mean you can't use this formula. But body itching. Now, I don't know of those of you who are working with COVID, but I've had a bunch of cases where people break out in rashes and have tremendous itching. So I'd be interested in the comments if people have also seen that. So simply clearing and disinhibiting or resolving the exterior won't be enough. So if you just go up and out, it won't work. This formula will resolve the exterior to scatter the evils and clear and disinhibit the damp heat. It can create open communication between the exterior and the interior. So just imagine that open communication, like the pores are now able to open and close as they should, so that the interior accumulation of damp heat can be led away. It can discharge out. This will cure the disease. He says yin chen hao can also be added to the formula for an even better effect. Here's another formula explanation. Xiao Dou transforms the congealed and disinhibits the damp. The sheng zi bai pi, that should be zi, guides to the skin and clears damp heat. Jiang and Zhao harmonize the yin and wei, thereby supplementing the correct. This formula resolves both the interior and the exterior and is appropriate to use for damp heat with yellowing when there is an accompanied exterior pattern. This formula resolves both the exterior and interior patterns. On the exterior, it resolves the constrained block evil, while on the interior, it clears up pent-up damp heat. In addition to treating jaundice due to hepatitis B, it has extensive use for contagious diseases. So this, we really want to pay attention. Extensive use for contagious diseases that involve digestive, urinary, neurological, circulatory, and respiratory systems. So now we'll look at the formula application. Itching skin with water blisters, erosion, and seepage. These are key characteristics of this dermatological illness. It can be seen with urticaria, eczema, seborrheic dermatitis, persistent acne, chickenpox, pityriasis rosea, viral herpes, like herpes zoster, allergic dermatitis, blocked sweat gland syndrome, pruritus, and body odor from the armpits. Also, heat effusion with water swelling are external manifestations of this urological illness. Heat effusion meaning like sensations of heat and feverishness. It doesn't mean on the thermometer. This is like the acute or chronic glomerulus nephritis, renal nephritis, uremia, non-gonococcal urethritis, and bladder infection. Damp-peak jaundice with inhibited urination as seen in jaundice of the acute hep B. This is a very important acute hepatitis B formula. Critical viral hepatitis, ascites of liver cirrhosis, post-surgical jaundice, cancer of the head of the pancreas, and jaundice of pregnancy. So lots of different diseases may fit this pattern. So in terms of treatment scope, we've got skin diseases. So very important dermatological formula. Renal illnesses, liver illnesses, circulatory illnesses, respiratory illnesses. That should say sinusitis. So you can imagine like the Yangming isn't open and there's this smoldering of heat and fluids in the upper body, how that can cause an acute respiratory illness like acute bronchitis or asthma or even sinusitis. And I have translated an ebook on this formula, and cases include whole body itch, chronic bronchitis, asthma, sinusitis, kidney infection, kidney inflammation, nephritis, and often comes with water swelling. And so this formula is often used for acute nephritis type of water swelling. And there's a whole part of the book that's on the use of this formula with UAB Xiao Dou Tang. Chronic urticaria, so skin rashes, and pediatric eczema. And this would be sort of blister-like or, the water blisters or damp type of urticaria or eczema, even acute poison ivy. This formula is great for. So just to summarize, these things that we're actually seeing with this virus, we're seeing strong respiratory issues, itching skin and rashes, blood stasis, heat damaging the fluids, and also kidney damage. So I'm just going to finish with a case from the ebook from Dr. Jiang Chongfu. Mr. Wu, age 16, came for an initial consultation. He had suffered from asthma in childhood, but it was fairly light. In the last year, it had become more serious. It came on every time he was exposed to cold. When he had an attack, his breathing became urgent, with chest depression and panting. It was not easy to cough up phlegm. He was sweating on his head and was unable to sleep. So sweating on the head, you can't say for sure that's Yangming. Like you wouldn't want to say to everyone who seemed like they were sweating in their face or on their head that it was always indicating Yangming, but you could say it should make you think about Yangming. And it often is related to Yangming. So this had gone on already for 1 week. Along with these symptoms, he also had mild heat effusion, aversion to wind, wheezing in his throat area, difficulty inhaling. His mouth was dry, his appetite was poor, his pulses were slippery and rapid, and his tongue moss was thin and yellow. So we know this is an excess heat pattern by the slippery tongue, the slippery pulse, which I consider a full heat kind of pulse, and the rapid pulse, but especially this yellow moss. We're definitely looking at a heat, an excess heat syndrome. So this was cold constraint giving rise to heat with phlegm mixing with heat, the external evil to block the respiratory tract so that the lungs could not spread downward. Ma Huang Lian Qiao, Xiao Dou Tang, was used to spread the lungs, dispel phlegm, and clear heat. So one thing, I want to suggest we really want to look for that wasn't mentioned here is really asking some penetrating questions about the urination. Is it a little bit yellow? Is it a little bit concentrated? Um, my guess would be in this case it probably was, but they didn't mention it here. But I consider it kind of a key thing to look for with this pattern. So this was the formula they gave. Now, I just want to mention, if we look at this and we see the relative dose of Ma Huang is actually pretty high because the Xiao Dou and the Song Bai Pi are so low. So there's more of a focus on the exterior in the way that this formula was designed. Usually, the dose in most of the cases that I've translated, the dose of Xiao Dou is 30 to 50 grams relative to the Ma Huang usually being like 6 grams. Lian Qiao being like 6 grams. Usually the amount of Xiao Dou is quite high, but here you can see why the emphasis was more on resolving the exterior. So he took 2 packages of the above formula and the phlegm became easy to expectorate. The panting stopped and the cough lessened. The right sun pulse was still slippery and big as well as rapid. So he did the same thing, removing the D-long because he was breathing better and adding D-go-P. So this was making it a combination formula of Ma Huang Lian Qiao Xiao Dou Tang with integrating the drain the white decoction, Xie Bai Tang. After 2 more packages, there was no more illness, and then he continued to sort of follow up with Yuping Feng San for a month, and later there was no recurrence. Okay, so that's the end of my presentation, and I would love to answer some questions if people have any. So
let's go to some questions. Thank you, Sharon, very much. And
you're very
guys,
welcome.
for the group sticking around. And we're going to do questions. A reminder that you can go to the resources page, healthyseminars.com/resources. We'll keep this replay up for a couple of days, and the last one's up there as well. And Sharon has many courses on healthy seminars as well, if that interests you. All right, let's pull out the hands. All right, we're going to Kathleen first. Kathleen, you should have audio.
Great. Hey, Sharon, thanks again so much. We all are so grateful for all your explanations and your lectures that you've been so generously giving to all of us. And I just want to say thanks. I have a couple of questions. One's a little longer, one's a quickie. The first one is on the chalky herbs. I'm wondering, how exactly do we know if an herb qualifies to be a chalky herbs? Like Shan Yao is obvious to me that would be a chalky herb. Red, well, it's white, maybe a little dry. Okay, I can kind of see how that's chalky.
But yeah, I can answer that. So, a lot of times they look like a piece of chalk. Like you could almost draw a hopscotch with the herb, right? If you take some shanyao or even like duan lungu or duan muli, right? You could draw a hopscotch on the asphalt with those herbs. So they look chalky in that way. But another is that they're very absorptive. So if you soak them in water, they increase in size. So even rice is a chalky herb, what does it do? It helps us absorb nutrients and fluids, and it stops thirst because now we're able to absorb our fluids, and it stops diarrhea because now the fluids aren't leaking out your butt, they're being absorbed. So if, and beans also grow a lot when you soak them in water. So that's another way that you can tell. And yeah, so I guess that answers the question.
Okay, so beans are considered chalky because they absorb water so well.
Well, yeah, and it's also, a lot of things absorb water. Like if you take dangshen, for example, it will grow if you soak it in water, but it's not a chalky herb because it's not, if you hammer it with a hammer, it's not going to turn into powder. It's not hard and turn into a kind of a chalky dust, where beans will turn into a chalky dust. So that's another way you can decide if an herb is chalky.
Okay, well then would Fushamai is like a grain like raz, would that be chalky?
No,
No.
it's not. It's more yeah, it's like if you pound fushamai, it's going to turn into gluten. It's going to turn into thick, sticky stuff. It's not going to turn into a dusty powder, right?
Okay.
Yeah.
So that's
And
one
and
criteria.
you can't draw a hopscotch with it. Like, let's say I took a bunch of Xiao dough and I ground it in my mixer, and then I mixed it with something that held it together. I could make chalk with it that I could draw a a hopscotch with,
Okay.
right? So I couldn't do that with fushamai.
Okay.
It would
And then
turn
my
into
quickie, okay, thank you. My quickie question is, you were talking about Lian Qiao and how great it is for sore throats, and you mentioned at high dose. And, you know, we're starting to hear the reopening instructions. And one of the things I heard last night was when we come home to shower and then gargle. And I was thinking about gargling with a Chinese herb. And I wondered if Lian Qiao would be good for that purpose. I guess the idea is if you had any of the virus in your throat from some exposure, you could gargle it and, you know, try to.
well, I don't know. You could try it. Um, it's sort of more, that's more on the lines of it clearing heat. You could try it. I think about more gargling with salt water because it pulls things out. But yeah, I think it's an idea. You could try that.
All right, thank you. Next, we're going to go to Allison. So let's unmute Allison. All right, for some reason I am having, oh, you're unmuted. Allison, go for it.
Hi, Sharon. Fantastic talk. I'm wondering, in that case you showed, what would be the differentiating factor between this formula and Mashing Shurgan Tang, except for the urination piece, which they didn't mention, but for them? I looked at that and I was thinking Mashing Shurgan Tang at first. I didn't get why you would turn
Right.
to
And
these.
in a way, it was more like a Mashing Shurgantong pattern, except that there were a lot of stuck fluids in the lungs, that he had a lot of phlegm in his lungs. So wanting to drain fluids out through the urination is what I think of.
Like a Shurgan Mahong Tang is like a stuck fluid in the lung, kind of more in
No,
the throat,
Shurgan
but
Mohong Tong is much more warming the lungs upward. It would be completely wrong because it would be adding a fire method, right? And really almost zero Yang Ming. To me, the Shurgan in that formula is only saying that the main symptom is this frog rails in the throat, that there's all this phlegm, but the phlegm is due to cold, not due to heat. Here, there's these fluids stuck in the lungs that are hot fluids, and then with the exterior pattern. So I think you're right that it was similar, very similar to Mashing Shurgantong, except that Mashing Shurgantong doesn't have a lot of fluid stuck in the lungs. It's not a phlegm formula. It's for when there's blockage in the chest, making it difficult to breathe, or that feeling of stuckness, but not a lot of phlegm in there. Yeah.
And then Shurgan Mahong Tong with Shurgao is still the watery, cold fluids, but with some heat signs present also. Compared to this case.
Like, could you give? But see, I wouldn't even have Shurgan. Why start with Shurgan Mahong Tong?
Yeah.
At all, because it's not. That's for cold fluids. So
I had kind of in my head organizing, like, if I see different people come in, it's like, okay, stuck chest without fluids is Mashing Shurgan Tong. This is with heat, right? And then really watery fluids is Xiao Qinglong Tong, or you could add Shurgao if there's heat. And then thicker fluids is Shurgan Mahong Tong.
No.
Maybe with Shurgao.
Thicker fluids is not Shurgan Mahong Tong. The it's still cold fluids,
Mm-hmm.
not necessarily thicker. It's more that they're really in the throat. It's like a whooping cough kind of formula where there's croupy cough where the throat is like you can hardly breathe because it's so blocked in the throat, but it's
Okay.
still cold phlegm, watery phlegm. So I think that idea that it's thicker fluids isn't right for the sugar
Okay.
Hong Kong. So yeah, you wouldn't have sugar ma Hong Kong plus Shurgao, because that would be sort of like Shaoqing Lungtang plus Shurgao. And it's also where the fluids and the heat have not really mixed. So there's not these phlegm fluids.
Uh-huh.
So
Okay, thank you.
yeah.
Thank you, Allison. And we're going to bring up Janine next. And I wanted to mention that we do hope to have more of these lectures from Sharon and her group. We're just not going to do it every day or 3 times a week, but we will have some more in the future. So do check out the resources page on Healthy Seminars. And if you get our emails, then we'll notify you then, and obviously open the emails and you'll get notification. Or just check out the resources page every couple of days. All right, you should have mic rights.
Hi, Sharon. Thank you so much for everything you've been sharing with us. It's been really, really helpful. And, I'm starting to think more about my patients who've just gotten pregnant in the last month or so. And as we have people going through this period of, the virus, there are starting to see some more miscarriages now, second trimester and third trimester miscarriage. And they're, looking at the placenta and the blood flow. And I'm just thinking about the Xiao Dou Tang, this formula, since it's used for, the jaundice and pregnancy. Is this something we could think about to use safely for patients once they've gotten into that stage of the illness where it's appropriate, I guess? But
Yes. So we also want to, be aware that the Xiao Dou also treats like blocked menstruation and failure of the lochia to come out, so it's got, and, opening the breast. So it's got some kind of opening through that I think we should be careful about that in pregnancy, right? Because we don't want to have a blood moving kind of purgative effect. Exactly. On the other hand, I think that quality is extremely mild, so I think that the benefits of it, if you have this kind of situation, far outweigh the dangers of the formula.
okay.
And there are so many cases in pregnancy where there's sort of an idea that you don't want to move the blood in pregnancy, right? But on the other hand, there are cases where if you don't move the blood, you will lose this pregnancy.
Right.
And there are many cases like that. And so we don't want to err on the side of like, oh, I can't do that because she's pregnant. I think in this kind of case, if you have this pattern, if you don't do it, you can lose the pregnancy. So I think, the subtleties of diagnosis, like that conversation with Allison was really great, like how the subtleties of using different formulas at different times is really important, to sort of make sure you've got that right. And to me, like, if you don't move the blood, you can lose a pregnancy. And so I think it would be very useful at certain stages.
Because
I wouldn't hesitate to use it if I saw this pattern.
Okay, thanks. There was a case where a woman presented at Lausanne Hospital. She had COVID, she had fever and muscle pain, diarrhea, dry cough. They sent her home with pain medication, and 2 days later she still had the fever and her symptoms had not lessened at all, and she went into labor and had a stillborn baby after 10 hours. So it felt like and they did find the virus. I know.
But that wouldn't be this pattern, right?
I know.
Diarrhea, dry cough, it's not this pattern.
I
know. So
know.
That's where we have to be really careful, right? Is it possible if she got the right herbs at the right time that could have been avoided? Yeah, I think so. But that doesn't mean this would be the right one.
Right. And everything's moving so fast is my point, I guess, that within 2 days, I mean, unless we can get it at the right time, it's going to be really hard to.
That's a really tricky thing about this time, isn't it? Like getting the right herbs at the right time. Yeah.
Okay, thank you.
Yeah.
All right, let's unmute Osmond, please.
Hi.
Hi, husband.
Thank you. I'm glad that you said, Lauren, that there will be more of these webinars. I was like, oh no, this is the last one. So I have a quick question. If we don't have Song by P at the clinic, is there any herb that we can substitute?
Why don't you have Song by P at the clinic?
I just, in my inventory, I was just checking, I don't have any, and I thought a patient who might actually get benefit from this formula.
So you really want to use it now. And you don't have anybody you could borrow it from.
I might be able to find from other practitioners.
Yeah. Gosh, let me think. Yeah, one herb I think of is jiegong.
Jiegong, mm-hmm.
Yeah.
I do have.
And you know, if you sometimes Song by P comes in these curly dry things, but there's some ways that it's given, it actually has a similar look to jiegong, similar color, that yellowy white, going to sort of earth and metal and generating water in a cooling way. So yeah, I think of jiegong.
On the classical formula app, it says the Yin Chen Hao, but it doesn't seem like
Yin Chen Hao is different, isn't
right.
it? It's like a bitter cold, drain heat through the urination. But Song by P, you know how we said it has this quality of clearing heat, but enriching the yin of the lungs at the same time. So I'm trying to think of what you might combine jiegong with that might make it a little bit more for draining through the urination, and maybe combined with yiren.
Yiren. Mm-hmm.
Yeah, like putting those together could sort of mimic the Song by P.
Mm-hmm. Thank you.
You're welcome.
Let's unmute Julia.
Hi, Sharon.
Hi, Julia.
So awesome to learn from you. Could you talk a little bit about the difference between the effect that bitter herbs have on dampness compared to chalky herbs and their effect on dampness?
Yeah, they're very different. They're very different. You know, the bitter quality has the quality of down bearing, right?
Right.
Bitter down bears, but also bitter parches. And so it's, you know, the flavor that is used in a lot of Yang Ming formulas, because when the Yang Ming gets blocked, it's not going down, but also fluids accumulate. And so it can easily get damp and damp heat. You know, the blockage means the life force gets blocked, so it gets hot, but fluids get accumulated. So the bitter opens the movement, the vertical movement downward, and also helps to parch dampness. Bitter in that way, it's drying, and whereas the chalky, it has an opposite direction, you know. And I saw in the chat somebody said about Zixia kind of pulling fluids up when it's growing in the swamp. It pulls fluids up, and I think that's also a nice image. Zixia is also a chalky herb, and so the direction is upward, right? Because it helps to absorb fluids so that they naturally drain, right? So you're not drying anything at all. So, you know, like an herb like Fuling or Shanyao or Gugan, they don't dry at all. In fact, Gugan's used for thirst. You know, Tianhuofen's used for thirst because you're finally keeping your fluids instead of them draining away. So it's really an opposite direction. It's up and in, and bitter is down and out.
Okay. And then I had one more question. With this formula, would would you use guiding herbs to push the formula to, say, the lower extremities if there was a rash on the lower extremities?
Absolutely, you can modify it a lot. And in the ebook, that if you're in the GMP, you'll get the ebook, so I'll put it into the Mahuang ebook as an addition. And you'll see there's all these cases, like when it's nephritis, and they're modified according to what the symptoms are that are showing up and where those symptoms are. And so, definitely you can add, there's a bunch of cases where Niushi is added to the formula. So
great.
Yeah.
Thank you.
You're welcome.
Thank you. All right, we're going to open up Monica's mic, and I just had a private message, so I'm going to share it publicly. So Sharon's course on healthy, I see it in the chat there now, clarifying diagnosis physiology. It is 25% off, and if you purchase the Prody Legacy version, you get that refunded. So it's over $600 in savings. It's a pretty good deal. So hopefully that clarifies to people. You put in the coupon during the month of May, that saves you 25%. And then in the notes, you say refund Prody Legacy, and then we go ahead and refund the amount you paid for on Prody Legacy. If you haven't taken it before, this is your first time, there's obviously no refund, but that's kind of how that works. Hopefully that clarifies that, and just email us through Help Desk. We're happy to answer those questions. Monica, you're live.
Hi, Sharon. I studied with you about 15 years ago in Seattle, and so it's been a while. But I have a couple of questions, and wondering if this formula is appropriate for an 8-year-old. I'm an auntie to an 8-year-old who has yellow hands. So it's not her whole body, but her parents saw her feet being yellow, which I didn't see. But one day I did see just the palms of her hands were yellow. And this was after the household was sick. And this was probably the beginning of April. And she just didn't get over it. She just was worn out and tired. Yellow hands. Also, she would wet the bed regularly. And the other thing was, she on gallbladder 40, she had this spot that was like a eczema, like a dry eczema.
So
unfortunately, I just want to say I didn't get the chance to just ask her a lot of things, because I was just thinking about this formula. I could maybe do some the beans or something and put it in with her food, because I'm trying.
Just be real careful, because one thing that I would suggest is to do a complete diagnostic intake, and ask yourself, how would I treat her if I didn't know she had yellow hands and feet? What would my diagnosis, and especially look at, is this mostly deficiency or is this mostly excess? And you'll know by her complexion, her tongue, and also, can you feel her pulses?
Mm-hmm.
Yeah. And so really her pulses are so important, and it's important to see, like, this is a strong excess formula, right?
Yeah.
And so it's going to show up in a pretty uncomfortable and acute way. And so I think the chances are that her yellowing, if she doesn't have difficulty breathing or a skin rash, a kind of prolific skin rash that's really bothering her, and kind of large slippery pulses, it wouldn't be this pattern. And it may not even really be damp heat. You have to look like it, or it could be like that the spleen is like somewhat damp, and this damp is just kind of hanging around a lot because she can't throw it off because she's a bit exhausted. So I think there can be a lot of reasons for yellowing that aren't necessarily excess.
And that aren't necessarily heat, is what you're
And that aren't
saying.
even necessarily, well, there's always some heat, but sometimes the heat can be just because the fluids are hanging around for a long time, but
Okay.
not it's internally not a heat pattern, right?
Okay.
And so like there's, what is it? Not Huangqi Fangji Tang. What's the yellowing formula? I think Huangqi Guizhi Wu Tang. And, where it's really not any kind of a heat problem at all, but you get a little bit of yellowing because the fluids are just hanging around too long.
Okay.
Yeah. So it's always a good thing to do, put something aside, like the fact that they have eczema or something, and say, how would I diagnose them if I didn't know they had this? And then from that foundation, go back and say, okay, now how do I explain the yellowing? How do I explain that? And see, rather than going from the yellowing to a diagnosis itself.
Okay.
Especially for symptoms that can come from a wide variety of problems.
Okay. Yeah, thank you.
You're welcome.
So next we got one last one because we're out of time, and then we're going to open up our mics, and so we're going to go to Martha, and we're going to open up our microphones and send our appreciation, gratitude to Sharon, to each other. Thank you again to Sandra and Lorianne on my team for since March 24th of just putting this content out regularly. We've had so much content going out, and having this opportunity for community, it really exceeded my expectation of you guys coming out and joining us. This is the last one we have scheduled with Sharon's group. However, I expect more to come because this has been fun and to teach. So stay tuned to the healthyseminars.com /
We have a lot of ideas.
We got lots of ideas. So just the resource
we're talking about it.
We're talking about it. So we're going to keep the resource page there. So just check it out and you'll see. We're going to play with the schedule and timing because a lot of people will be working again as well. But I do want to thank you guys and thank Sharon and thank my team. So Martha, we're going to have you ask your question and then we're going to open our mics. Please remember, if your speakers are muted, you're missing this, but there's always somebody who is not part of the group having their own conversation. That's going to get picked up. So let's see if that happens in a second or two. Martha, let's take your question and then we'll open up the mics and send our community love to each other and Sharon.
Thank you very much. Thank you, Lauren, and thank you, Sharon. These are really wonderful experiences to have. And I have a really quick question. Where are you purchasing Ma Huang from?
Oh,
don't even answer that.
Honestly. I won't answer that, but you can. I've traveled to Taiwan and come home with suitcases full of it and stuff.
Okay.
Yeah.
I paused the recording. Okay, guys, I paused the recording. It's like asking a drug dealer where he gets his stuff. It's not allowed in the States, so don't even ask that question publicly. All right.
Sorry, I didn't mean to be a problem.
I'm sure people get it, but don't ask that question. Like, don't do that again when you're talking this. You're gonna have to find out amongst yourselves where you get your contraband stuff, but don't ever ask that stuff publicly because you'll lose it all for the whole country. So don't ask that.
But it's a very good question.
It's a great question.
Yeah, it's a great question.
But it's not a public thing. You got to call someone privately.
I do have my sources, so you can ask me privately.
But I just let you know I paused the recording so we don't have people banging down Sharon's door next week. All right, I'm going to hit the recording again, and then we'll open up our mics. I understand why you asked the question, Martha. I just have to tell everybody we don't ask that because you'll lose it. You got to find that got to go meet Sharon in the dark alley and ask her the question. All right, let's open up our microphones.
No.
Thank you very much.
Thank you so much, Sharon.
Thank you,
Sharon.
Thank you, Sharon. Really appreciate it. Thank you so much.
The chat, I hope not to be using these in the near future, but definitely feel free to send you. Thank you Thank you so much. Great. Thank you, Lauren.
Thank you very much for your work.
Thank you, Marianne. Thanks, everyone. Thank you.
Bye, everyone.
Bye. Thank you.
Thank you so much. Thank you.
So Okay, great. Friday, do check out Going Back to Work. That one I think is just the logistics. I think it's an important one that we need to know so we can show up and practice safely. And so do come to Friday. You sign that up now. And if you missed my Conscious Tuesday talk, there's an introduction. Remember, I couldn't do the, we ran out of time for the meditation. So the introduction is available now on if you go to the resources, May 11th to 14th, you can watch the introduction talk. And then those that are registered, I put the meditation in so you can start doing that mini meditation before we start on Monday. Be well, everybody, and I'll see you guys online. I'm hoping on Friday for Back to Work. Check out healthyseminars.com/resources for your resources. Be safe. Love my community. Take care, everybody. Sharon, thank you.